Hi, I'm Jane Wells with CEOs You Should Know, and you are?
John Baackes, CEO, LA Care Health Plan.
What is LA Care Health Plan?
Well, we're the largest public entity health plan in the United States. A regular health insurance plan, but our focus is Medi-Cal beneficiaries. So the population we serve are people who are living and working in poverty.
And where does the funding come from?
Well, we're contracted with the Department of Healthcare Services in California, so they give us a payment, like an insurance premium, to take care of Medi-Cal beneficiaries who select us or are assigned to us, and that's our income, and it's no different than an insurance premium.
What were 2018 revenues?
They will be $7.5 billion.
Wow.
And we will retain, our bottom line is about $200 million.
How many customers do you have?
We have 2.2 million people.
Wow.
All in Los Angeles County, so basically every fifth person in the county is a member of LA Care.
Wow. How long have you been there?
I've been there a little over 4 years.
Where are you from?
Well, I was born and raised in the Midwest, but my professional career prior to coming here was all in the Northeast.
It seems most of your career you have been in this industry,
Yes.
but also dealing with lower income customers.
Well, I was involved from the beginning in what we would call a full-service health plan, and it was great. But as I went along through the years, I began to see that we were discriminating against people on the basis of the plastic card in their wallet. So if you were uninsured, you couldn't get in to see certain doctors. If you were on Medicaid, certain doctors wouldn't take payment from Medicaid and you couldn't see them. And even Medicare, which pays more generously, there were doctors that said, we don't want anything to do with it. So it seemed to me that that was not right.
Did you always want to be CEO? Did you always want to be the boss?
No, I can't say that I always did, but once I was the boss, I didn't want to go back to not being the boss.
I can't think of any industry that is more difficult to understand and certainly to know even what things really cost than healthcare. If you could do whatever you want to healthcare and the insurance side of it and the cost transparency side of it work, what would you do?
Well, first of all, healthcare is not rocket science. It's way more complicated. Certainly, if anybody were starting out with a blank piece of paper, you would never design what we have now. It's one kind of innovation on top of another, and we never go back and clean up the old stuff, so it is a mess. Now, if I were king of the world and could design a healthcare system, I would probably design something that what people today would call a single payer system, where there would be just one organization that ran it and made sure people had access to healthcare. But we can't merely say today, oh, that's a great idea, let's do it. Because we have built up an entire system for over a century that's based on private insurance and private practice of medicine. And I think to get to where we need to be, we're going to have to do it in smaller incremental steps. And that's one of the things about our current health system that I think we forget when people say, let's throw it all over for a single payer system. Lots of innovation has come out of the way we're organized today. What I don't want to lose is that element of competition, because to me that leads to innovation.
We need doctors, right?
Yes.
What are you guys doing about that?
Well, there's a severe doctor shortage, and there are many reasons why.
Why? What's the main reason?
The main reason is the cost of medical school. It's outrageous. Every other first world country either pays for or materially contributes to the cost of medical education. The United States does nothing. And the average debt of graduates now is about $200,000. That then drives those doctors to make decisions about their career that will put them into higher reimbursing practices or specialties. So we'll go to surgery, we'll go to radiology, we'll go to something that will pay me more so I can pay off my student debt. I went to our board and said, let's take 5% of our reserves, and instead of having it in a very pitifully low interest conservative investment, let's invest it in the community. So we set up a 3-tiered program, well now it's 4 tiers, where we would provide grants to practices or clinics in Los Angeles County who serve the safety net to bring in a new primary care doctor to the county. And they could use the $125,000 any way they want. They could supplement the salary, they could pay for recruiting expenses, moving expenses, whatever. Knowing that most of the doctors coming in will have medical school debt, if those doctors agree to stay for 3 years, we'll retire $180,000 of their debt. Then we want to build a pipeline for the future. So we are created LA Care Scholars, and we provide 8 scholarships a year, 4 at Charles Drew Medical School in South LA, and 4 at the UCLA Geffen School, and they're full 4-year rides. Then we've added funding for 5 residency programs, which is what you do after you go to medical school. You go to a residency program for 3 years, and then you can be a doctor. So I'm pleased to say, since we announced this program last summer, we've given out 72 grants, and 50 doctors have already been hired that weren't here a year ago.
Tell us something about yourself which might surprise us.
Well, I went to college on a Caddy scholarship.
What? There's a Caddy scholarship?
You betcha.
What college is this?
Well, it's not a college, it's a program called the Evans Scholars. And unlike the movie Caddyshack, where the kid had to play golf to get the scholarship, you didn't have to play golf. You had to caddy at a club. It's been around since 1930, and there are today 985 kids in school on the scholarship currently, and there are about 10,000 of us who are alums, and we're now the largest source of money for the program.
I have never heard of this.
Right.
Were you a good caddy?
I was terrific.
Can you golf?
Yeah, but I gave it up about 15 years ago.
John, thank you very much.
Well, it was my
That
pleasure.
was great.
Thank you.